My name is John Mouledoux. I'm the Senior Director of Communications for the University of California, Irvine. I work in the Strategic Communications Office, which is charged with getting out the good word about the great works of the university. I've been here since 1999. In the fall of 2010, I began to feel ill while I was at work. And I excused myself and drove myself home, where my son was there. And when I got home, I told him I was just going to go lie down for a while because I wasn't feeling well. And when I didn't start feeling better, I asked him to call 911 because I had a good sense that I was about to have a heart attack. I had tightness in my chest, I had pain in my arm, sort of the traditional indicators of an impending heart attack. My son called the paramedics and they came out right away and they tested me, did the EKG and such, and they told me I wasn't having a heart attack right at that moment, but advised me to go into the ER to get tested. I asked my son to drive me up to UC Irvine Medical Center, and unfortunately, before we could even get in the car, I suffered the heart attack. Now, fortunately, the paramedics had not completely packed up and left the driveway yet, so my son was able to run out to the front of the house and get the paramedics to come back in and revive me. They actually had to paddle me, so they took me to the local hospital, since I live in Lake Forest. It was in the South County area, which is where I had a stent put in through a femoral angiogram. And they told me that the cause for the heart attack was a complete blockage of my LAD, the left anterior descending artery, or the widowmaker as it's known as. I went home with these new prescriptions and was feeling like the worst was past, but unfortunately that wasn't the case. I experienced some additional difficulties, like my blood pressure lowering to an unsafe level, and so we had to call the paramedics out again, and they took me to the local hospital one more time, and then we had to make arrangements for me to get to UCI. And at UCI, they admitted me into the ICU and began running a battery of tests just to see what it was. We suspected it was the medications, but we weren't quite sure. They adjusted the dosages and some of the different medications. And I eventually ended up in the cardiac care unit in the new hospital, where another battery of tests were done, more medication changes, but ultimately Dr. Patel thought that what would clear it up for good is to do a radial angioplasty. You know, with the radial angioplasty, they were able to go in through my wrist into an artery and go in and check the heart, make sure that the stent which had been put in doing its job, and also to see if there were any other blockages in the heart. And what they found was that there wasn't any additional intervention needed in the heart itself, and that it really was a question of adjusting the prescription medicine that I was on. The care that was provided from top to bottom was just outstanding. And I also came to know that even when a shift change came around, I had no concerns over a drop in the level of care. It was just excellent at every turn. My follow-up care has been quite encouraging. Dr. Patel and my primary care physician have both been very responsive and provided tremendous advice in how I can best manage my health going forward. Overall health and energy and all, I'm feeling terrific, better than I have in quite some time.